Hi everybody, thanks to Rosemary from Craig's Table for allowing us to present today on the importance of a pharmacist in injury management, and it's especially important this time of year at Injured Worker Wellbeing Week. My name's Luke and I'm the Director of Independent Med Management. I'm a pharmacist, a registered pharmacist. I've worked in a number of roles that's led me to my current position as Director of Independent Med Management. And Taylor, she has extensive experience in the medico-legal field, almost 10 years experience in that space. I created the company called Independent Med Management for the purpose of having greater involvement by a pharmacist within the insurance space. And like Craig's Table, which is created by an injured worker for injured workers, Independent Med Management was actually created by a pharmacist with the focus on pharmacy intervention within the insurance space.
We essentially provide medication review services for injured people on behalf of insurers. More specifically, we like to think of ourselves as medication management specialists. So we delve a little deeper into the reasons why people are on their medications, some risks associated with their medication use, offer further education to insurers, treating parties and injured people, and we do that through a collaborative approach. So we do case conferencing and treating party discussions to enhance communication between all treatment providers.
The goal of today is to provide some information and education to injured workers and to empower them to take a bit of a control over their recovery and treatment plans. We're going to talk about the role of a pharmacist both in the hospital and the community setting, specifically what your community pharmacist can do for you as part of your treatment plan and recovery journey, and the importance that education that they can provide to you from their perspective in relation to the medication use and the risks associated with taking medications throughout your recovery journey.
Some of the topics that we will cover today also include the risks that we see from medication use, particularly within an insurance claim.
Yeah, we'll also provide some examples from our perspective as what we see problematic within the insurance space, and just give some general advice and tips on injury management and case-specific disease states and conditions and how to best manage them.
So before we get started, I think it's important that people have a really clear understanding of the role of a pharmacist. So why don't you tell us a little more about that?
Yeah, I think the role of a pharmacist varies depending on the setting that they're included in, and that can be between hospital and community pharmacy. And within the hospital setting, a pharmacist is generally part of that treatment team. So they're involved in the prescribing and dispensing of medications from the hospital perspective, but they also work collaboratively with the treating doctors to ensure that the correct medication is prescribed at the correct dose for the right person. And that differs a little bit once you move from the hospital to the community setting. I think the biggest differentiating factor from hospital to community is the lack of the treatment team that you see in the community and the disconnect between the GP or the treating doctors and the pharmacist. Within the hospital setting, you might see the doctors and the pharmacists working simultaneously to prescribe the medications, but you don't get that opportunity as a community pharmacist to have those direct conversations with doctors to ensure medications are being used to treat different conditions and making sure that the correct dose is given. So you kind of lose that team effect once you're in the community as opposed to the hospital setting.
We do know that it is really important to have a pharmacist involved in treating teams. Some GP practices now are even implementing pharmacists within their practice full time. It is becoming more relevant and people are becoming more aware of the need for a pharmacist in their treatment overall, obviously within the general community, but more specifically within the insurance setting.
I think it works very well in the fact that doctors are really known for being good at diagnosing and generally prescribing medications, but we also know that pharmacists are basically the medication experts and medication specialists, for lack of a better term. So they do work really well collaboratively, and that's what we emphasise a lot in the fact that pharmacists and doctors should be working synergistically, I guess, to help improve medication use throughout somebody's injury or treatment.
So we are here today to talk to injured people. So they are aware of their own experiences within the insurance setting. So I think it's really important that we highlight the risks that we see from a pharmaceutical perspective, but more specific to them and their needs.
I think one of the biggest issues that we see in this setting is multiple prescribers and multiple people being involved in the treatment, especially early on. So people go from being fully healthy one day to, an injured person with complex issues the following day. And if we look at the age groups of people that get injured at work, they're generally people that don't have the comorbidities and things that you'd expect in the older population. So often they're unfamiliar with doctors and prescribing and all the different treatment providers available, and they kind of get thrown in the deep end a little bit because they've gone from being healthy one day to complex issues the next.
So some of the issues that we see with that obviously are the multiple prescribers, multiple pharmacies, multiple conditions that they didn't previously have, deteriorating conditions or secondary conditions, so side effects due to medication use or psychological impacts because now that they can't get back to work and it's affecting their family and home life and relationships. So there are a multitude of needs suddenly appearing. That obviously comes with a multitude of medications and treatments. So what in an insurance-specific sort of setting do we see as common issues when it comes to pharmaceutical management?
Yeah, well, it kind of goes back to that same issue of multiple prescribers, and I think that's a good thing to have multiple treating people, but it needs to be coordinated by one sole prescriber. And the reason for that is once you have those complex issues, and specifically with the secondary conditions, whether it's a physical and psychological condition, often there's multitudes of medications being prescribed. So with that comes greater risks of interactions and overdose potential, whether that's accidental or purposeful overdosing. So the need for consolidated treatments is fairly important when it comes to that. And that's not necessarily just early on in the case. I think that comes with later treatments as well as the injuries progress.
So let's look at some really specific sort of examples. So things like dosage creep. What does that sort of highlight for you?
Yeah, dosage creep for me, from a pharmacist's perspective, kind of indicates that the medication's ineffective at treating a certain condition. That can be pain, but it can also be psychological and antidepressant use as well. So being able to identify the ineffective medications being used early in the piece means that dependence and addiction doesn't become an issue with that medication, and the person's getting treated with the optimum medication. So exploring alternative medications and not just relying on one medication or increasing that dose of medication because it's not generally doing the job that it's intended to do early in the piece. So tolerance is another issue that we see, and that's when the body produces tolerance to a specific medication, meaning that an increase in dose is required to elicit the same effect. Addiction and dependence is another issue, and that can come through extended medication use or being used outside of the indicated time. But that can also become apparent within the first 3 to 5 days or less than a week in some cases, depending on the medication. So
I think that's really important to highlight because most people think, you become addicted to your medications after months or years of taking it. And they really aren't aware of the fact that that can happen in 3 days in some instances.
Yeah, absolutely. And I think if they're aware of those issues or potential issues when they're first prescribed the medication, it means that they're more informed and they can make those decisions based off evidence and education before it becomes problematic. Or if they do experience some dependency within that short-term medication use, they're aware of it and they can make the adjustments later on, knowing that it might be difficult to cease the medication, but they're aware of the reasons why it's difficult to cease. So medication combinations are also problematic throughout the insurance scheme. Comes back to the fact that people are being prescribed medications by their GP, by another GP, but they might also be taking medications from over the counter, either being provided by their pharmacist or from Woolworths or Coles. It's seemingly low risk medication that they're getting from these places, the pharmacy or Woolworths, and the issues don't seem apparent to the average person. So people were healthy one day and then had complex issues the next. So they might have been taking these medications over the counter to aid in different things, and now there's potential for those medications to interact with the medications they're being prescribed for their current conditions in the workers' comp or CTP setting. So the issues that we see might seem simple to most people, but can be quite complex when used long-term or in combination with other risky medications. I think a simple example of what a low risk or a perceived low risk medication interaction with another medication would be simple over-the-counter anti-inflammatory medications with a prescription anti-inflammatory. And the duplication in medications might actually cause pretty severe adverse effects and can even lead to things like kidney failure if used long-term or in excessive doses. It can also lead to stomach irritations or stomach ulcerations if left untreated as well.
So there are obviously pretty severe side effects from things that, I might just take because it's in the cupboard at home. Unfortunately, people with complex injuries and new conditions, that's not an option. You do need to be thinking about everything holistically and ensuring that a doctor or pharmacist is managing that and educating you on that.
That's why we point out a lot of the time that all over-the-counter medications should be somewhat prescribed or at least recommended by the GP. And that's not as a fail-safe as such, but it is to make sure that the doctor's aware of all the medications that you are taking, and then they can limit the risks associated with that as well. It also comes back to the fact if you can use one pharmacy for all of your medication use, then that pharmacist has the sight to oversee all of the medications that you're using as well, and again limit the risks and adverse effects that you might potentially get from taking those medications.
But if you are also, needing new medications to treat side effects or other symptoms, it is possible that they are due to the medications that you're taking for your other conditions.
Yeah, absolutely. I guess it comes back to everything's quite complex, and if you're unfamiliar with treatments and medication use, then the pharmacist is the perfect port of call for all those educational needs, and ask those questions, raise the concerns, and you should be able to receive the answers that you need. But also, it might come back to the fact that the pharmacist can identify a particular medication that's causing the adverse effects and make recommendations back to your doctor to change it or change the dose to limit that so you don't have to live with it long term.
And I think that's also part of the purpose for medication reviews or pharmacy reviews, is to look at everything holistically, because especially in long-term claims or, ongoing and worsening or multiple conditions, we do start to see more treatments for more side effects and other symptoms that might not seem so serious or important, but obviously can contribute to other issues. So in the insurance space specifically, with long-term and ongoing claims and multiple conditions, we start to see symptom treatment rather than condition treatment. So we start seeing more and more medications being introduced to treat, sleep, but they could be on a medication that causes insomnia and things like that. So it's really about identifying the cause for your symptoms and these new issues that you might start to have. And that's where a pharmacist really comes into it.
And it can be such a simple fix as changing the time of day that you're taking a particular medication, especially if that's known to cause insomnia. Just as simple as changing that to taking it in the morning might eliminate the need for sleep medications or the side effect of insomnia as such.
So let's talk about some of the resources that are available to injured people.
I think first and foremost is the pharmacist is the most readily accessible health professional that you'll encounter. So utilising your pharmacist as a resource for all your health concerns is probably my point of call. I would go to my pharmacist if I had questions.
I think it's important though, when you do go to your pharmacist, if you have had a niggling thing come back, playing on your mind or something that you haven't experienced before, bring it up with them before you just collect your medication. I know that it can be difficult in a, busy pharmacy with multiple people standing around, but ask the questions. And if someone isn't available, ask for a time to speak to them when they might be more available.
It comes back to building that relationship with the pharmacist for sure. But other resources that are available are your GPs. So I know they're sometimes time poor as well, and speaking to you and talking about multiple different ailments at the same appointment, that can be quite difficult. But just raising any concerns that you might have or asking any questions, especially if you've got something new or a new medication is being prescribed, ask the question, say what's this being used for, even ask how it works if you wanted to.
And even more importantly, long term though, you could be on a medication for 6 years and your condition and your medications are stable, but things change, your body changes, the way you respond to your medication changes, and the way that medication works for you changes. What worked yesterday might not work tomorrow, or there could be better or new alternatives available. New symptoms, new conditions or side effects that you might be experiencing, as well as, no change. If there's no improvement in pain, it probably isn't doing the right thing as well.
But there's more formalised reviews and things that can take place from the GP and the pharmacist, and often you won't be able to get to have the medication review done there and then from a pharmacist or a GP, but if you wanted to schedule a time in, a pharmacist can sit down with you and go through all of your medications, all of your doses, over-the-counter medications, and just make sure that there are no interactions and there's no adverse effects that you're experiencing that may be attributed to the medications you're using. So asking to speak with the pharmacist and scheduling that time would probably be a good starting point as well. And then that keeps you informed as to where you're up to with your medication use and what the long-term plans are for medications.
And in terms of services available through your insurer, obviously they have access to a whole bunch of rehab and treatment providers that they can put you in touch with, and as well as us. So you can have your medications reviewed by a pharmacist. We can do case conferencing at the request of your case manager. So always be in contact with them, let them know where your treatment's up to and if you are needing further support, because it is available. It's also important to highlight that Craig's Table is a really valuable resource for injured people as well.
Yeah, and I think support networks and support groups are really valuable for people, especially if they can speak with like-minded people or people that are going through similar circumstances to themselves. But also Craig's Table is there to point them in the right direction for information if they need it. So they're not relying on Google and platforms that potentially have unreliable resources. So ensuring you're getting the right information from the right place is as important as the information that you're actually getting. So even though there's a lot of online resources available, speak with a health professional, pharmacist, doctor, people like Craig's Table to help point you in the right direction so as the information that you're getting is accurate. So some of the takeaway messages from today's video and from our company in general would be for injured people to be involved and actively involved in their treatment. Take an active role and ask the questions that you need to ask at the right time, and that'll stop things progressing to getting worse potentially just because you don't want to ask the question.
But it also gives you choices. Having a voice, being able to take back that control, and just participating in discussions, the decision-making processes, and understanding what's available, who's there to help, your responsibility, who's accountable for following up what with you, and what you're accountable for doing as well.
Yeah, and I think choosing your treatment team, you've got the right to choose whoever you want to see as a doctor or a pharmacist, and making sure you choose the right people to build those relationships with so they can be proactive in your treatment as well. And so you can feel comfortable asking the questions and getting the information from the right people as well.
So just highlighting again the need for one pharmacy as your sole dispensing pharmacy, someone that you trust, someone that you have a relationship with or would like to build a relationship with, as well as one main prescribing doctor. Whether that's a pain specialist or your GP, trying to minimise the use of two separate GPs or doctors that are only available when they're available, just keeping that consistency just to ensure that you're getting the best treatment all the time.
And once you build the relationships with these people, you're more open to trialling different things as well. Everybody should have your best interests at heart. So if you're open to trialing different strategies and different treatment plans, then it's likely that they're going to find the right treatment for yourself.
And also having that relationship and past history together, they know what treatments you've trialed. Going to IMEs and different doctors all the time can be so draining for a person to have to explain their whole past all over again and try to get them to understand the different things you've trialed, all the alternatives that you've talked about previously. So having that relationship and someone that isn't going to keep offering the same treatments over and over because they understand that didn't work for you will take a lot of the, stress out of your ongoing treatment plan.
And look, we as health professionals understand that it's a pretty difficult road that you guys are walking, but you're not walking it alone. And so just being sure that the people that you've got around you have got your best interests at heart and gives you that reassurance to trial those alternative strategies. And they might be some difficult strategies, physical therapy and all of those treatments that are included as part of the treatment plan aren't easy, but they're there for a purpose. And if we pursue that and we push through the barriers and things together, then hopefully there's light at the end of the tunnel and we can get you back to full health, potentially return to work or return to life.
And that comes from obviously the non-pharma treatment, so physical rehab as well as other pharmaceutical options. Rationalising your medication regime to try and reduce the number of medications or reduce the number of side effects just to make things easier for you. It's not about getting that number down. It's about optimizing it and making sure that the medications you're using are the most beneficial for you.
And Rosemary said it herself that the workers' compensation shouldn't be a roadblock, it should just be a detour. So let's work together to help optimise medication use and optimise your recovery journey. If you have any questions regarding medication use, then the avenues would be to go through your GP or your pharmacist, but speak with your case manager, and IMM's here to support injured workers and optimise medication use from our perspective and bridge that gap between prescribers and pharmacists and injured workers, and to make sure that everybody's on the same page. Jump online, you can see us on our website, on our LinkedIn, social media, all those avenues, or contact us directly if you need to.
Perfect.